Welcome to the Divine Inspired Care channel. Do you know what happens during a heart attack? It's a medical event called infarction or MI. This starts when the heart muscle, the myocardium, lacks necessary oxygen. Normally, this shortage is caused by a blockage in the coronary arteries, responsible for supplying blood to the heart. When oxygen supply is cut off, it can lead to the death of the heart muscle cells. This harmful sequence where heart muscle cells perish due to oxygen deprivation is known as necrosis. Remember to subscribe, like, and share our... Now, you may be wondering, what are coronary arteries? Simply put, they're our heart's lifelines, indispensable for its functioning. They transport oxygen-abundant blood to the heart muscle. When blocked, oxygen supply is cut, causing severe damage. Obstructions can lead to the death of nearly 500 heart cells per minute. It's a critical situation. If not addressed within 45 minutes, the destruction becomes permanent. This is serious, as it can lead to the loss of approximately 500 heart cells per minute. Time is of the essence in such situations, because if the blockage isn't resolved within 45 minutes, the damage may become irreversible. So what causes this blockage? The prime culprit is fatty substance accumulation, often known as plaque. It isn't an overnight occurrence, but a product of a long-term exposure to unhealthy choices. Key contributors include stress, which temporarily narrows arteries, and habits like heavy smoking and poor diet, culminating in obesity. Additionally, medical conditions like diabetes and hypertension play a significant part in this buildup. They speed up plaque deposition, escalating the blockage even more. This accumulation is not an overnight phenomenon, but the result of prolonged exposure to unhealthy choices. These conditions expedite the plaque accumulation, further escalating the blockage. Did you know that African American males over the age of 50 and men in general are more susceptible to heart disease than women? This fact is confirmed by various medical studies. It's a stark reality faced by many African American men, influenced by lifestyle habits, genetics, and environmental factors. Poor diet, inadequate exercise, high stress, and hereditary conditions are all contributors. It's not merely about gender or ethnicity, but a multitude of variables. This complex issue calls for our attention. We should be vigilant about our health, particularly heart health. The aim is to urge everyone, especially men, to prioritize their heart health and take preventive measures. Prevention is always better than cure. Let's make steps today towards a healthier life. So, did you know that African American males over 50 and men in general are more susceptible to heart disease than women? What are the symptoms of a heart attack? They could vary significantly amongst individuals, but common ones usually include discomfort in the chest, which is often described as pressure, squeezing, fullness, or pain. This discomfort can sometimes spread to other areas of the upper body, such as the jaw, left arm, or even the back. Shortness of breath is another recurring symptom which may occur with or without chest discomfort. Some individuals might experience additional symptoms such as cold sweats, nausea, or lightheadedness. At times, feelings of impending doom or severe anxiety can also accompany these physical symptoms, heightening the individual's distress. An important aspect to remember is the occurrence of silent MIs, heart attacks that happen without the usual symptoms. This condition is particularly common amongst diabetics and women. Despite the absence of classic symptoms, these silent MIs can be equally as deadly. The diagnosis of a heart attack is typically a meticulous process, often involving an electrocardiogram or ECG. This test measures heart activity by interpreting electric signals. It's a fast, non-painful way to give essential heart health insights. The diagnostic procedure also includes assessing troponin levels, a protein in heart muscles. Its levels can dramatically rise during a heart attack. Stress tests, another crucial aspect of the process, can reveal blockages, particularly in arteries. This method effectively helps doctors to diagnose heart attacks and prompt necessary treatments. With these methods, doctors can effectively diagnose heart attacks and take the necessary steps towards treatment. When it comes to treating a heart attack, the immediate goal is to re-establish oxygen supply, crucial for our body. Oxygen absence renders our cells dysfunctional, especially impacting the heart. Professionals may use certain medications, including Mona, lauded for its efficacy in medical circles. Still, there could be instances where drugs aren't enough. In such scenarios, doctors may opt for surgeries. They might select interventions like angioplasty, a lesser invasive operation, bypass surgery, a method that reroutes blood around a blockage, or endarterectomy, which removes an artery's inner layer. These procedures might be necessary. After enduring a heart attack, a patient's existence transforms significantly. Health experts recommend a cardiac-friendly nutrition plan, incorporating fruits, vegetables, lean proteins, and whole-grain foods. Stress reduction is also crucial. This can be achieved by adopting practices like meditation, yoga, or simple breathing exercises. Regular physical activity serves a critical function in recuperation. It helps enhance cardiac health and overall physical endurance. Specific drugs may also be part of the treatment, including antiplatelets, statins for reducing cholesterol, and medications for regulating blood pressure. These all work in unison to aid a heart attack survivor's recovery. Antiplatelets, cholesterol-lowering statins, and blood pressure-lowering drugs are often part of this regime. However, heart attacks can lead to severe complications, like cardiogenic shock, arrhythmias, and heart failure. These conditions can result in dangerous, potentially life-threatening outcomes if not treated promptly. Cardiogenic shock happens when your heart can't pump sufficient blood for your body's needs, resulting in low blood pressure. This could trigger a condition known as arrhythmia, a situation of irregular heart rhythm that may cause dizziness. Arrhythmias can harm your heart muscle, resulting in heart failure. Heart failure is a chronic condition where the heart struggles to pump blood efficiently, causing symptoms like agitation and reduced urine output, indicating the heart's inability to pump enough blood to the kidneys. Therefore, it's vital to monitor for signs like low blood pressure, agitation, and reduced urine output. In conclusion, understanding myocardial infarctions is vital for our health. These are often severe heart incidents presenting without warning. Awareness is key. Symptoms include chest discomfort, breathlessness, and fainting spells. It is equally essential to recognize risk factors, such as the trio of smoking, obesity, and hypertension. The lifestyle choices we make significantly influence our susceptibility to these heart attacks. Mitigating these risks is within our control and is of utmost importance. Medical intervention must be immediate. Delays can worsen the situation, while prompt action may considerably reduce long-term harm. This acknowledgement of urgency can dramatically improve survival outcomes. Most importantly, acknowledging the urgency of immediate medical intervention can significantly mitigate long-term effects and improve survival rates. Before we wrap up this enlightening journey through the intricacies of heart attacks, we would like to remind you to subscribe to our channel for more informative content like this. Don't forget to hit the like button if you found this video useful, and share it with your friends and family to spread awareness about this life-threatening health issue. Remember, knowledge is the first step to prevention. Stay informed, stay healthy. Thank you for watching.